Hi.
Hello, good morning.
Hi, good morning.
Hi.
How are you doing today?
I'm doing great. How are you doing?
I'm doing great as well. Thank you for asking. What brings you in today?
My daughter Savannah has been coughing for weeks now, so it's getting very worrisome. So yeah, I just want to know what's wrong with her because I'm very concerned about her.
Okay. So before I start, can I please have the name of the patient?
Savannah.
And then can I have the last name?
Orozco.
Orozco. Before I start, I need to go ahead and ask some questions about COVID-19.
Okay.
So, have you had any symptoms of cough in the last 14 days?
Yes.
Have you had any fever in the last 14 days?
No.
Have you had any shortness of breath in the last 14 days?
Yes.
Runny nose?
Yes.
Okay. Loss of taste or smell?
No.
Chest pain?
Yes.
Fatigue?
Yes.
Have you been tested positive for COVID-19 in the last 14 days?
No, she haven't. We actually just got our test done yesterday. 2 days ago, the result came in yesterday. It was negative. So.
Okay, so COVID-19 was negative. Okay, perfect. Then I'll go ahead and have you fill up the form for me.
Okay, Miss Savannah? Guys, can you sit right here?
Okay, thank you.
Can I also get your finger? Okay, it was 122/78. Okay, respirations were 14. The last one, if you could please stand on this weight for me. Well, okay, 4 feet, 9 inches. Okay, I'm gonna take you back into the room, okay? Okay, so this is the room. You can sit here.
Okay, thank you.
And we're gonna be assessing your lungs today, okay? So here's your gown.
Okay. Yes. Hi, Miss Savannah. Hi, Mom.
Hi.
How are you guys doing?
Good. Thank you.
My name is Stephanie. I am going to be your nurse for today. I do have a student nurse, Ugo.
Hello.
Is it okay if he's in the room with us?
Yeah, sure, no problem.
So I do see here that you came in for a cough, shortness of breath, runny nose, chest pains, and fatigue, correct?
Yes.
Okay. Is it okay if I ask you a couple of questions?
Yes.
Okay. So when did your cough start?
About 2 weeks ago.
Okay. And is the cough gradual or is it sudden?
I think it's more sudden.
Okay. And how long does it usually last?
It just depends.
Oh, mostly all day.
Yes, mostly
Okay.
all day.
And when you cough, are you coughing up any mucus or blood?
Mucus, mostly, right?
Yeah.
Okay. Is there anything that makes it worse or better?
I don't know.
Yes, actually, when she goes up the stairs, she has very difficult time breathing, and it's very painful to watch, and she cries too when it gets.
Mom, have you given her any medication?
Yes, I gave her some NyQuil and some Dayquil, and I also gave her like hot tea with ginger and garlic, and like it just doesn't really help.
Is there any past history of breathing trouble or lung disease, such as bronchitis, emphysema, pneumonia, or asthma?
Yes, our dad actually has bronchitis before he passed away, so.
Okay, I'm sorry to hear that he's no longer with us.
Thank you.
And I do have to ask, do you smoke?
No.
Okay, and do you have any allergies, such as seasonal allergies or any allergies to medication?
I do sometimes have seasonal allergies.
Okay, my student nurse is going to go ahead and perform the physical assessment of your chest and lungs. Is that okay?
Yes.
Yes. When we're with the patient, what do we want to go ahead and check first?
Inspect his skin.
Inspect.
Okay. The skin color is uniform, no signs of cyanosis. Okay, I'm going to picture your finger. Is that okay?
Yes.
Okay, have your other hand, please. Capillary refill less than 2 seconds and do the index finger. And no signs of clogging.
Oh, if she did have clubbing, what would that indicate?
COPD.
Awesome.
Okay.
And then we want to go ahead and test for chest expansion.
Okay. Okay, AP transfer ratio, it's 1 to 2.
Okay. So that would be if there was a barrel chest, what would that indicate?
COPD.
COPD. Okay. And we also want to check for chest expansion.
Equal chest expansions.
Okay. And then we want to palpate the chest, and we want to check for any tactile chromitis. Did you feel any vibrations in the chest?
No. Oh, yes.
Yes, you did.
Yes.
Okay, yes. Scared me there, Ugo. So with increased rhinitis, that occurs in compression or solidation of lung tissue, which is commonly in pneumonia. So we want to make sure that there isn't any increased rhinitis. If it was decreased, it would occur when there's an obstruction of the transmission of the vibrations. So that's good that she didn't have it. Now we want to percuss the anterior and posterior of the back.
Thank you. Okay, resonance predominates on all areas.
Okay, awesome. So if we had a hyperresonance, that would be found when there's too much air present in the lungs, or any dullness when note signals of abnormal density in the lungs, which would be in pneumonia, so that's good that she didn't have it as well.
Okay.
So next, we would auscultate.
Okay. Okay, I heard wheezes over the bronchiovesicular areas.
Okay, so adventitious sounds over bronchiovesicular area. Okay, so wheezes do indicate asthma or bronchitis. If we were to hear any crackles or rails, that would occur in pneumonia. Okay, so I think that completes the physical assessment, Ms. Savannah. And Mom, we'll go ahead and give our notes to the nurse practitioner, and they'll be ready. Okay, Miss Savannah, and Mom, they do want Savannah. She did order her an x-ray, so we're going to go ahead and take her back for imaging. Do you have any questions?
What is an x-ray?
An x-ray is just going to be an imaging of her chest. It'll show us the lungs, if there's any inflammation inside or any fluid builds up.
Okay.
Okay.
Yeah.
Yes? Okay. So if you want to go ahead and follow me, let me take you back over there.
Hello, Savannah. I'm the nurse practitioner. How are you doing today?
I'm okay, thank you.
Alright, so looking at your files, I see that you came in for some chest pain and shortness of breath and coughing up some mucus.
Yes.
Okay, well, so the nurse did order an x-ray, and then I went ahead and went to go look at that, and it is showing some inflammation and some fluid buildup in your lungs. So it typically when you have that, it's a sign of bronchitis. So bronchitis is just an inflammation of the bronchi and the linings of the bronchi. And so that's why you're going to see your mucus, you're going to see inflammation, and you might have some symptoms of cough, fatigue, or sore throat. So I'm going to provide you some antibiotics, some anti-inflammatory drugs, and some bronchodilators. So typically there's not really a medicine to help with this. It goes away on its own, but you can use over-the-counter medicines such as venison, such as Mucinex and Robitussin, about 600 milligrams taken every 4 hours to help with the inflammation. And just make sure you are drinking plenty of fluids to help with the mucus. And do you have any questions for Emo?
Yes, so what if she takes this medication and it doesn't work or it doesn't help?
So typically you want to wait to at least 2 weeks to see the decrease in cough and stuff. So typically it should help if you take it as prescribed every 4 hours. You don't want to skip a dose, but if you do skip a dose, just go ahead and take it when you remember, but just make sure you're still having a time schedule of taking it every 4 hours.
Okay.
And lots of fluid.
Okay.
Yes. So I have some brochures about bronchitis. If you want to go ahead and take a look at that.
Okay. Thank you.
Okay. And just come in for a checkup in 1 to 2 weeks to see how your cough is improving or if it hasn't improved. So I'm going to go ahead. I did see that they performed an assessment on you, the nurse. Just going to go ahead and confirm those assessments. Okay, so I am hearing a little bit of shortness of breath and a little bit of wheezing, but it's nothing too concerning. Of course, this is your first time being diagnosed with bronchitis, correct? Okay, so any acute bronchitis is typically not a cause for concern, and your shortness of breath and wheezing subside in 2 weeks.
Okay.
Okay, so thank you so much, and here it is. And the nurse will go ahead and give you the prescription, and thank you guys so much.
Thank you.
You can take that to any pharmacy, okay?
Okay, thank you.